Hi, I'm Dan Reardon, doctor and health and fitness expert on fitnessinventor.com, and I'm responding to a question asked today about exercising with high blood pressure, and specifically if we have any tips for exercising with high blood pressure. So my first point is that if you have high blood pressure, it can respond very well to exercise. There are studies that have shown you can get a reduction in your systolic blood pressure with a prolonged period of training and a prolonged period of exercise. But you should also remember that there's lots of other benefits to exercise. So my top 10 tips for exercising with hypertension are as follows. And I should also point out that whilst we're talking about hypertension, I also like to class heart disease in the same category, as hypertension does have the potential to progress to heart-related illnesses. My first point is that you should always discuss any exercise programs with your doctor, especially if you do suffer with any medical problems. It's also important if you take regular medications, because sometimes medications can interfere with exercise tolerance. I'll give you a good example of this. When I was at medical school, we did an experiment where we performed an exercise activity, which was walking on a treadmill, and we then took a beta blocker, which is a common tablet that's used to treat high blood pressure, and about 30 minutes after taking it, we exercised again, and you can't perform anywhere near the level of exercise you could before you took the beta blocker. And that's because it slows your heart rate down, and therefore your heart and your body can't respond to the increased level of exercise and demand for oxygen, so you just can't work as high capacity. So it's very important to discuss medications with your doctor. It's also important to think about factors in your life that might make you tired and therefore affect your ability to exercise, and see if they can be modified. Do you have an abnormal sleep pattern? Making sure that you exercise at such a time of the day that you're alert, and you're exercising at times of the day when you're not knowingly going to be tired. Exercising at times of the day when you've consumed perhaps 1 or 2 meals so that you have energy, and also thinking about your pre-workout nutrition and so on. So we're talking about my top 10 tips for exercising with hypertension. It's really important to remember and really important to avoid lifting very heavy weights. When you lift very heavy weights, there's a tendency to hold your breath, and that in itself can cause your blood pressure to go up, and we're exercising to try to reduce blood pressure. So don't lift heavy weights. I would suggest performing any resistance work, and it's light-based resistance work in a seated position. This is because sometimes when you have high blood pressure and if you're on regular medications, you can sometimes experience a little bit of dizziness. If that happens, you should always consult your doctor. But obviously, if you're in the gym and that happens, if you're in a seated position, it's a lot safer than if you're standing holding the weights. It's always important as well to make sure that when you exercise, your body is higher than your legs. So, for example, if you were doing an abdominal workout and you were lying on the mat and you had your legs raised in the air, if you've got high blood pressure, this will be a bad thing. And this is because you get a lot of blood flow in your legs, and you get a massive surge of blood from your legs that goes to your heart if your legs are higher than your heart, and that potentially can increase blood pressure, so that wouldn't be a good thing. It's important to avoid exercising outdoors in extremes of temperature. This is because, so for example, if it's very, very hot, you can fatigue very, very quickly, and therefore it reduces your exercise tolerance. If you then try and work at the same intensity as what you normally work at, you essentially might be working at a much higher intensity, which could put you at risk. And the whole point of exercising with high blood pressure is we want to try and control the intensity that we work at to get the most beneficial results that we can. You should avoid hot baths, and in fact cold baths and showers before you work out. This is because obviously when you alter the temperature of the external environment, it can alter the way blood flows through your body. So if you're having a hot bath or a hot shower, your skin blood vessels dilate to try and release heat. And this is a bad thing, because we want the majority of our circulation and our blood going through our muscles and our heart, not necessarily through our skin. So you should avoid hot baths and hot showers, and also cold baths and cold showers. Be careful when you're walking up really steep hills, and in fact you probably should avoid walking up really steep hills, because this puts a much greater demand on the heart. You can fatigue a lot faster, the intensity of that work is a lot harder, and potentially could increase your blood pressure, and we don't want to do that. If you find that your exercise program gets interrupted, so for example you go on holiday or you're ill for a few days, When you resume your exercise program, don't just go back to the intensity that you were working at before. Gradually increase your intensity back so that you give your body a chance to readapt. Again, you don't want to create problems as a result of exercise. You want to try and manage your health problem, which is your high blood pressure, and that's through controlled exercise and controlling the intensity of how you work out. Don't exercise if you're not feeling well. That doesn't just mean for people with high blood pressure, that's for anybody. If you're not feeling well, don't exercise. Whether it's that you've got a fever or you've got an infection, anything like that. The issue with exercise is that studies have shown it can sometimes reduce your immunity. So if you're not feeling well when you exercise, you potentially can make yourself feel worse. These sort of things go without saying, but if you get very short of breath when you're working out, reduce the intensity and rest. If the shortness of breath continues to be a problem, then you should seek medical attention or go and see your general practitioner or family practitioner. It might be that you're on medications that are affecting your breathing. They might need to be increased, decreased, and so on. If you notice that your heart starts racing and you're getting palpitations, which is the feeling of your heart beating in your chest and it's going very fast or irregular, slow down and stop and rest until that goes away. If it doesn't go away, seek medical attention. If you start noticing you're getting any chest pains, you should also immediately cease exercise, rest, and if the chest pains don't go away, seek medical attention. And irrespective if they don't go away, if you are getting chest pains, exercise, then you should certainly go and see your general practitioner or family practitioner, as these might be symptoms that you're suffering from a condition called angina. So just in brief, my reasons why you should stop exercising, specifically if you're suffering from high blood pressure and heart disease, but this goes for anybody, is that if you start noticing you're getting chest pain, abnormal weakness, dizziness or lightheadedness, if you start noticing that you're getting unexpected weight gain or swelling, you should also seek medical attention. And obviously, if you start noticing when you're exercising you're getting pressure or pains in your chest, in your neck, in your arms, in your jaw, in your shoulder, you should discuss these symptoms with your general practitioner or family practitioner, or if the symptoms are very, very bad, you should consider consulting a doctor in an emergency department. So I hope I've given you some useful tips here for exercising with high blood pressure, and please feel free to ask further questions on the topic.